popping up on my screen and taking my. Sorry, just letting some more people in, sorry. So challenging behaviour might include things like biting, it might be hitting, swearing, hair pulling, self-injury, sort of meltdowns. Really, as I say, any behaviour that can impact on a young person's life and the life of their family. But behaviour is often just the tip of the iceberg. It's what we see on the surface. So that, as I say, that might be things like angry outbursts, aggressive behaviours, screaming, crying, somebody becoming withdrawn. There are so many different kinds of behaviours, and that's just what we see on the outside. And as I was saying earlier, if we just become focused on that and we just try to target that without thinking about what is underneath that behaviour and what might be lying behind that behaviour, then we might not intervene in a way that is helpful. So there can be many things going on under the surface of that behaviour. So it might be that somebody is feeling really anxious. It might be that they're just really frustrated. They might be in pain, and often we forget about the sort of physical things that might be happening, whether somebody might be, you know, physically unwell. They might just be feeling completely overwhelmed with the environment. They might just be feeling kind of hopeless about things. They might be feeling rejected by friends. Perhaps they've got things going on in their life, like big life events, and we can often forget about how life events might impact on children, even if they're not fully aware of things that are happening around them or fully understand them. Children can be very good at picking up on kind of other tensions that are around in their environment, which might lead them feeling sort of confused and distressed. They might just be really tired, and we know lots of children who are on the autism spectrum have difficulties with their sleep, and if you're not sleeping very well and you're tired, then often that can lead to sort of more difficult behaviours. Somebody might just be feeling really kind of sad and unhappy about things. They might have sensory needs, and children on the autism spectrum generally do, and it's one of the kind of key features. So they might be very sensitive to too many noises, or they might be sensitive to smells, and those sort of sensory difficulties can then lead to sort of difficult behaviours. They might have health problems, so if they might have, for example, something like an earache, and they're not able to communicate and to tell us that they've got an earache, so then they might express that through their behaviour. It might be that there are things going on in their life, difficulties at school, bullying, teasing, or other sorts of life events that are impacting on them. Difficulties with communicating. If we can't talk about how we feel, we can't tell people how we're feeling, then often the only way we can show people how we're feeling is through our behaviour. It becomes a kind of non-verbal form of communication. And then also there is how people around us are responding. So often with behaviour, the way that people respond to that behaviour can reinforce it. So by reinforcement, what we mean is that any kind of response that might actually keep a behaviour going. So sometimes we might respond to behaviour without realising that our response is actually making that behaviour more likely to occur again in future. So a sort of fairly typical example of that would be, for example, if a child wants something in the supermarket, the child is told no, they can't have it, and then they have, you know, a kind of big sort of tantrum and throwing themselves on the floor and screaming, and then the parent might kind of give the child what they want in order to stop that child from doing that. And then by doing that, the child has then learned, actually, in future, if I want something and I'm told no, this is a pretty good way of getting what I want. So that's a fairly sort of, you know, classic kind of example when we're thinking about sort of more sort of typically developing children. And that's why often sort of typical sort of parenting approaches sort of talk about, you know, ignoring and not giving in. But I'll be talking today about the reasons why some of those more sort of traditional parenting type approaches don't always work with young people who are on the autism spectrum. So for young people who are on the autism spectrum, it's quite common that they do, you know, present with behaviour that challenges people, and there can be lots of reasons for that are related to, you know, the way that young people on the autism spectrum kind of understand the world. So people on the autism spectrum just have differences in the way they kind of process the world, the way they make sense of the world around them, which means that they might not always be interpreting things or understanding things in the same way that you or I are. And that means they might respond to things in a way that to us doesn't seem to maybe make sense, or it doesn't seem, you know, very predictable. So one of the key features of autism is difficulties with communicating. So often young people will have speech and language difficulties that can lead to lots of frustration because they can't get themselves understood, or they can't, you know, they can't get their point across. And then frustration can lead to you know, quite difficult behaviours. But even young people on the spectrum who've got quite good language skills can still find it difficult to actually communicate. So they find it difficult to talk about their feelings, find it difficult to engage in conversations, and even the non-verbal aspects of communication can be difficult. So they might not always pick up on people's face expressions or be able to read people's kind of body language in the way that other people might be able to. So they might not pick up on those cues if somebody's angry or if somebody's upset. So then they might not respond in the right kind of way. Difficulties with social interaction is a key feature of autism. So being in social situations can be really difficult. Trying to make friends and start interactions can be difficult. So young people might experience kind of rejection or from other children and become quite isolated. And they might find social interactions and social situations just really anxiety provoking. And when we are anxious, we all kind of have this response that all of us have, and it's a natural inbuilt response that when we're anxious, we go into what's called fight, flight, or fight mode. So when we go into kind of fight mode, that means our body has interpreted something as a threat. It's interpreted a situation as a threat, and then there is a kind of physiological reaction in the body, a release of adrenaline that gets the heart pumping, you know, gets our body ready to kind of defend itself and protect itself. So often when people talk about young people being aggressive, when we look at that and we dig a bit deeper, often what we find is that although it might look like aggression when you look at the behaviour, because the child might be kicking or you know, slapping people, it might look like aggression, but it's not always anger that is the reason for that behaviour. The person might just be really, really anxious and they've gone into fight mode and they're trying to escape. And it's really important to understand the difference about when is it anger and when is it anxiety, because the response will need to be different. And then flight mode is when somebody's just trying to get away from a situation by, you know, by whatever means possible. And the other response might be to freeze. So that's almost like the rabbit caught in headlights. When we're so frightened, we just freeze and we just shut down and can't respond. And as I mentioned earlier, there's sensory processing difficulties. So children might be really sensitive to certain sensory things. And so certain noises in the environment might just become really overwhelming for them, or lights, crowds. All of those things can be triggers for challenging behaviour. And difficulties recognising emotions is another feature. So not just other people's emotions, but often their own emotions. Young people on the autism spectrum often find it really difficult to recognise and label when they feel happy or when they feel sad or when they feel anxious. So they just react to those emotions, often, you know, through behaviour, and express those emotions through their behaviour because they haven't got the sort of skills really to kind of talk about those. And difficulties regulating emotions is another kind of feature of autism. So for most of us, if we're feeling sort of angry, or if we're feeling anxious, we're able to recognize that, and then we can usually do things to kind of bring that emotion down. So that's what we mean when we refer to regulating emotion. It's our ability to kind of keep our emotions on a fairly kind of even keel. But for young people on the autism spectrum, they can find that a lot harder, because they don't recognize the emotion often in the first place to be able to manage it. So positive behaviour support is a sort of different approach really to managing behaviour to the kind of more traditional parenting approaches. So sort of traditional parent approaches often focus very much on behaviour, and they're quite reactive. So it's very much about, if a child does this, then you should do this. And quite often approaches are based on sort of punishment type approaches. So if a child does something wrong, you put them on the naughty step, or you take their PlayStation away from them for an evening. And the idea of those approaches is that if a child does something wrong and you then follow that up with something negative, the child will learn, I'm not going to do that in future because something negative happens. Positive behaviour support really moves away from that kind of an approach. It never uses punishment as a strategy. So the reason for that is positive behaviour support recognises that when young people on the autism spectrum display challenging behaviour, most of the time they're not doing it deliberately. It's not a willful thing. They're not, they're not being sort of manipulative. There can be lots of other reasons for their behaviour, and the behaviour often has some sort of function. There's a reason for it. So responding with things like the naughty step often, is really ineffective. So positive behaviour support is really about understanding why is this behaviour happening, and it's about kind of gathering information about that behaviour. So rather than just being really reactive and seeing a behaviour and just jumping in, it's about trying to kind of really understand what's going on behind that. So it does take it is an approach that does take a bit of time and a bit of effort, and often when people are presented with behaviour that is challenging and that they're really worried about, people often just want a quick fix, which is understandable. But there often isn't one, and we do need to take that time to try and understand what's happening. So it's gathering information about, how often does this behaviour happen? So what's the frequency? Is it every day? Is it twice a day? Is it once a week? How long does the behaviour last? Is it just 5 minutes, or is it an episode that will go on for 2 hours before the child sort of calms down? And how intense is the behaviour? So does it just go from a kind of mild sort of episode, or are we talking about kind of really sort of intense, kind of severe behaviour? And it's important to kind of gather that information, because it can help us try to then understand what might be going on for the young person. And it's PBS is really about trying to see the behaviour as a communication. So what is the behaviour telling us? And really, what is the function of it? So what purpose does this behaviour serve, and what is the child trying to kind of get? So research has found that generally behaviour serves sort of 4 main functions really. So one is to gain something. So a child might be presenting with certain behaviours because they want to get something, might be kind of getting access to the iPad, or getting access to some food that they want. It might also be a way of initiating an interaction. So a child might sort of slap someone or push someone, and again, it's not that they're being aggressive, that they're just trying to get a reaction off of that person. So they're, in some way, they're trying to initiate an interaction, but not doing it in a way that is the right kind of way to do it. It might be that they're looking for some sensory stimulation. So somebody might engage in self injurious behaviour, like sort of scratching themselves or picking at their fingers or biting, because that gives them some sort of sensory kind of feedback. So it shows really why understanding the function is quite important, because if somebody is displaying difficult behaviours and the function is because they want sensory stimulation, if we then respond to that by just putting them on the naughty step or taking something away from them, that's not going to stop that behaviour, because we haven't addressed what the function of that behaviour is. As it might also be to get out of a situation or to avoid something. So a behaviour might serve different functions at different times. So things like biting at sometimes that might be a sensory thing. At sometimes it might be a way of getting out of a situation. And different behaviours can serve the same function. So in order to get out of a situation, a child might use 4 or 5 different types of behaviours. So it changes, and I think that's one of the difficulties about sort of supporting young people challenging behaviour, because there is no sort of rule book around it, really. There's nothing that says if a child does this, then we should do this. The key is about taking that time to gather the information and to try and understand what's happening. So to start with, often just thinking about having a bit of a kind of checklist. So if you're concerned about an aspect to your child's behaviour, I mean, we would usually recommend don't try and tackle all of the different behaviours all in one go. If we see lots and lots of children who are maybe presenting with a number of different behaviours that are concerning for people. When we would usually say pick the top 2, so sort of almost do a bit of a priority list. What are the 2 behaviours that are really the most concerning, that are having the most impact on the child's life, and which, focus on them ones first. And then, be thinking about how often is that happening? When does it happen? Does it happen every morning when you're trying to get ready for school? Does it happen when you pick your child up from school? Is it happening at dinner time? And who does it happen with? Does it seem to happen with one person more than another? Maybe one particular teacher, but then with another teacher, the child behaves, in a different kind of way. How often is it happening? Is it every day, a couple of times a week? How long does it go on for? Are there times when it doesn't happen? Because that's really useful information as well. And people that it doesn't happen with. Or are there times when it happens less? And so looking at that behaviour and answering those questions can sometimes give you some clues about what might be happening. So if you notice that a child behaves in one way in the supermarket, for example, but then they don't show that behaviour when they're at home, then you'd be thinking, well, what is it about the supermarket that's different? The supermarket's really noisy, it's got lots of bright lights, it's very busy, it's unpredictable. So then that can give you some clues about, well, maybe the reason for the behaviour then is that environment is too overwhelming for that young person, and maybe the function of the behaviour is to escape and get out of that situation. And collecting this kind of information before you get started on any sort of behavioural intervention or behaviour plan is also useful, because it gives you a bit of a benchmark, so that you can come back to it later on when you have implemented your sort of behavioural intervention. You can come back and compare, have things changed, have things improved, is the behaviour happening less since we did that? So keeping behaviour diaries is really a really important first step. And as I say, it does take a bit of time and a bit of effort, but it really is such an important first step if you're trying to think about how to alter or change some behaviours that are concerning you. So think about the acronym STAR. So the first thing is setting. So where were you when the behaviour happened? So sitting at the dinner table, or in the supermarket, or at the swimming pool, just so literally just the place where you were when the behaviour happened. And then the trigger, what happened, what was happening just before the behaviour occurred. So the setting might be sitting at the dinner table, gave my child, so the trigger might be then gave child a plate of food with chicken nuggets and beans and chips, and then the action is exactly what did the child do. And again, it's important to try and be really exact about this, because often in my role I speak to parents you know, daily about concerns about their child's behaviour, and when I ask what happens, they might say, well, they just kicked off, and then that's actually quite difficult then for me to know how to respond to that, because my understanding of what kicking off looks like might be quite different to what somebody else's understanding of what kicking off looks like. And it's the same if parents say, I want my child to be less aggressive. What does that mean? You know, what does aggression mean? So being really clear about the behaviour. So it might be they kicked the wall 3 times. It might be they slapped me 3 times. So exactly describe the behaviour. And I'll you know, explain why that's important when I go on to give some examples of PBS. But one reason why it is important, again, is when you come later on to sort of look back and see, is this behaviour plan working? You want to have that you know, really clear information in order to be able to make a comparison about whether things have improved. And then record, you know, what you did in response to that situation, or what other people did, because that can sort of identify if there are occasions when people might be reinforcing the behaviour without realising it. So just to give an example, and this is a real life example of a young girl I worked with you know, some time ago. Obviously it's not her real name. So this was a young girl who was in a specialist provision for young people who had autism or learning disabilities. And the school were really struggling to manage this girl's behaviour, because she just kept sort of launching herself at people in her class and would just sort of scrape her nails down their face. And there didn't seem to be any trigger for this. She could just be sitting there and she would suddenly just scratch the person sort of sat next to her. And the way that they were responding to that was they were then removing her out into the corridor and sitting her on a chair out in the corridor. So I spent a bit of time observing this young girl in class and just gathering some information over a period of time, just to try and get a sense of what might be going on. So I've included here an example of what the sort of star kind of diary would look like. So the setting was the classroom. On one occasion, the trigger seemed, the young girl was sitting there at a table with 4 other children. Initially was sitting there fine, and then suddenly turned to the boy next to her and scratched his face, and then the teachers removed her from the class and put her on the chair in the corridor. So that just really is an example of how you can use these kind of diaries to gather that kind of information. And then alongside that, we were sort of recording how often it happened, times when it didn't happen, whether there were people that it didn't happen with, just to sort of really get some ideas about what might be happening for her. So once we have kind of gathered those ideas and we've got a bit of an idea about maybe what the function of behaviour might be, whether it is about sensory, whether it's about escape, whether it's trying to initiate an interaction, or whether there might be other things happening for that young person, like events in their life, we can then start thinking about what the intervention should be. So, as I said, in PBS, punishment strategies are not effective. So those traditional techniques of grounding someone or taking something away from them generally doesn't work. So strategies tend to be either proactive or reactive. So proactive strategies are where we try to intervene before the behaviour even occurs. So once we have identified why a behaviour might be happening, for example, if we identify there's a particular trigger for a young person, like there being too much noise in the environment, then we can be proactive and we can do something to alter the environment. So whether that be wearing ear defenders or something else, we can try and do things to reduce the chance of that behaviour occurring. And then reactive strategies are things that we do in response to the behaviour once it's occurred. So that might be things like removing the person from the situation if they're seeming overwhelmed. It might be trying to distract them. It might be sort of taking something away if it's something that's causing the person distress, or it might be sort of ignoring certain behaviours so that we don't reinforce it. But a good sort of behaviour support plan should always really aim to have more proactive strategies than reactive, because the idea of PBS is about trying to reduce the chance of a behaviour occurring in the first place, rather than just responding to it once it's there. So things like removing and altering triggers is a proactive sort of strategy. Recognising those signs when a child might be starting to escalate, in their body language, and then distracting them or removing them from that situation before it develops into a full-blown sort of meltdown. It might also be about teaching skills, which is another key part of positive behaviour support. It's about not just targeting behaviour, but thinking about how can we teach children skills that might mean that behaviour it doesn't serve a purpose so much for them anymore. So if somebody's behaviour seems linked to communication difficulties, and somebody is behaving in a certain way because they're frustrated, because they can't express themselves, then sort of teaching them communication skills might really help to reduce their frustration and therefore reduce the chance of that behaviour occurring. Or it might be teaching them sort of social interaction skills. So if we can see that a behaviour might be linked to a kind of skills deficit, then teaching those skills might reduce the chances that behaviour happening, rather than just focusing on the behaviour. It might be we have to make certain adaptations to the environment so that the environment isn't so sort of overwhelming for the young person or so anxiety provoking. So, for example, I know I keep using the supermarket example, but if you notice that is a really difficult environment for the child to be in, then an adaptation might be to go at times when it's a lot less busy. That a lot of places now recognise, like for example, cinemas recognise that it can be really difficult for people on the autism spectrum to be in that environment. So there are cinemas now that do like autism friendly screenings, where they lower the volume and they kind of dim the lights, and they allow the young people to kind of move around a bit more without anyone sort of complaining. So often it is about how we kind of adapt the environment around, people that are not just young people who have autism, but, people that have additional needs. So rather than us expecting young people to be the ones who completely change, it's about us also recognising that we might need to change things around that child, because of their sort of individual needs. And we might try to provide alternatives to a particular behaviour and then reinforce that behaviour. So if somebody, if a young person, for example, is using slapping to try and initiate interaction, if they then initiate interaction in a more positive kind of way, then we would be like praising them and reinforcing that sort of behaviour. So just to give a kind of couple of examples of what PBS kind of can look like in action, the first case I'll talk about is a case of a young child who I worked with a number of years ago, who was in reception school. So reception year, sorry. So around about the age of about 5. And this young boy had a diagnosis of ADHD and was also waiting to be assessed for possible autism. And the school were really struggling because this young boy was being aggressive. That was what they said. They said this boy's being aggressive to other children in the playground, and it's leading to other children getting hurt, and parents were complaining about that. So the school were responding to that by keeping this boy in at break and not letting him go out to play, because that was the sort of school's policy. You know, if you did something wrong at break time, you got a detention. So again, that kind of more traditional sort of punishment approach. But actually, what they found was that that approach didn't help with this young boy at all. By the afternoon, he was really unable to cope in the classroom because he hadn't had the chance to go out and play and burn off that excess energy. And when he did go out to play, he just carried on doing the same behaviour. So just keeping him in at break time and giving him attention actually wasn't teaching him anything. It wasn't dealing with the you know, the reasons why he was behaving like that in the first place. So again, using a PBS type of an approach and gathering information and you know, using those kind of star charts to explore a bit more what was happening, what we could see was that what this boy was doing at break time was he was running up to other children and he was kind of giving them a bit of a push, which could be interpreted as aggressive. But actually with this boy, when we observed him, what he was doing was he was kind of pushing the children, but then he was running off and he was looking back and he was smiling. And it seemed that actually what he was trying to do was initiate a game of chase. He was trying to get the child to play with him, but obviously doing it in a way that you know, wasn't appropriate, and he didn't seem to understand that and wasn't picking up on the fact that children were unhappy or you know, angry about it, because he couldn't read those sorts of non-verbal cues. And then looking at the environment and looking at when the behaviour happens and when it didn't happen, we noticed that the behaviour only happened at playtime. Generally, when he was in class, he was a lot more kind of settled. He didn't go up to other children and push them. So we then thought about what's different about the classroom environment versus the playground. You know, obviously the classroom is a lot more structured. It's more predictable. Whereas the playground was, in this particular case, the playground was a very, very large playground. It was combined like infant and junior school. So at playtime, you know, it was a very busy kind of environment. And our sort of, I suppose our theory was perhaps this boy is just overwhelmed in the playground and doesn't quite know what to do, doesn't know what's expected of him, and it's just too overwhelming. So with PBS, it kind of, you know, you use that approach to sort of develop, I suppose, some theories, and then that guides your behaviour support plan. So with those theories, our behaviour support plan was then around how do we teach this boy some social skills, like attending a social skills group so he could learn how to initiate interactions more appropriately, using things like social stories to help him sort of understand other people's reactions when he did certain things. And then we also looked at how we could make the playtime a little bit more structured for him and a little bit more predictable. So one of the playground attendants used to sort of introduce some games at playtime, like hiding beanbags around the playground, and he could go and find them and things. So you can see how PBS is a sort of fairly different kind of an approach to that traditional one, because it was really about not necessarily just focusing on the behaviour as such, but thinking about how can we introduce these other things like social skills training and social stories to address the sort of root cause of the behaviour and what's really underlying it. So going back to the young girl of Emily, who I showed earlier, when we gathered information and looked at it, it seemed like the function of her behaviour and the reason why she was sort of scratching children was to get out of a situation. So when we talk about functional analysis, what that means is that when you've gathered all of your information about why a child might be behaving in a certain way, you then sort of basically analyse it and think, okay, what's the function here? So it seemed with Emily that when she was sat with children, she could only cope with that for a certain amount of time, typically about 5 minutes. Any longer than 5 minutes, and that tended to be when Emily would lash out and scratch people. So she would become sort of gradually more and more tense as she was sitting with people, and you could see that in her body language, that she was finding the situation more and more difficult. So when the teachers were responding to that by taking her away and sitting her in the corridor without realizing it, they had actually reinforced that behavior, because Emily had learned, I don't want to be in this situation anymore. If I scratch this person, I get taken out of it. So the next time she wanted to get out of a situation, that is what she did. So proactive strategies, and you know, again, using that kind of PBS type approach and being proactive and sort of thinking, how can you intervene first, was around, you know, we'd identified that 5 minutes was about Emily's kind of limit before she couldn't cope. So the idea was to sort of step in before those 5 minutes were up, you know, pay attention to her body language, to notice when she was becoming more kind of aroused, and then stepping in and removing her from the situation before she had got to that point where she scratched somebody. But also what we wanted to do was teach her a new way of communicating when she wanted to leave, rather than communicating it by scratching. So the teachers introduced a sort of visual. It was like it was a picture of the chair in the corridor, so that when she needed to leave, she would start using that rather than scratching. So the way that was kind of introduced is that when they could see her becoming aroused, they would offer her the picture and let her leave, and then kind of eventually over time working towards her being able to independently use that herself to request when she needed to leave. So I'm just going to give a couple of examples with, trying to think about some of the behaviours that we sort of hear about a lot from parents, that parents sort of struggle with. And as I say, there isn't a particular that there's no sort of rule book that kind of says, if a child smears, then this is the approach, or if a child does this, this is the approach. In a way, it doesn't really matter what the behaviour is. The principles of PBS are still the same. It's about gathering that information, thinking about the different functions of behaviour. So in a child who's smearing, I mean, first of all, we would always say just rule out any underlying medical cause, in making sure the child isn't suffering from something like constipation or some other sort of physical thing that might be leading to them displaying that kind of behaviour. Once any sort of physical cause had been ruled out, then we would just say, go to recording it, record in those diaries, how often it's happening, when it's happening, etc. All the things that I've sort of spoken about, the times when it isn't happening, and then sort of think about that function. So is it a way of getting attention? Because quite often if a child smears, they get an awful lot of attention, don't they, as parents or as adults. We obviously react to that, and people can react to that quite strongly, because it is quite a concerning behaviour to deal with. It might be that they do it to get out of something or to avoid a certain situation, or it might be that they're getting some sensory feedback from it. They might like the feel, they might like the smell. So approaches then might be along the lines of minimizing attention as much as possible. So really try not to react when your child is displaying that behavior. When you're cleaning your child up, really try to minimize any kind of interaction with them, like not talking to them too much. So if the child is doing it for an element of attention and interaction, you're then not going to be reinforcing that by giving them too much attention. If it seems that it might be possibly about a sensory thing, then provide alternative sensory experiences. So it might be things like finger paints, Play-Doh, strong smelling things, and trying to sort of encourage the child to engage with those activities, and then giving them lots of attention when they're engaging with those things can be helpful. And if a child does give attention in a way that is more appropriate, try to respond to that as positively as you can, and sort of as quickly as you can. I mean, obviously we can't always give people immediate attention, but noticing when a child is trying to get your attention in a positive way, it can be helpful. Similarly with self-injury, if a child is doing things like head banging or scratching themselves, again, rule out any underlying health problems. I have seen cases where a young person might be displaying sort of self-injurious behaviour, and it turns out that there has been a health problem that's been overlooked because people were just seeing it as a behaviour. So, you know, for example, once working with a young boy who was repeatedly hitting their head, and everybody was very focused on how to manage this behaviour, and it actually turned out this boy had quite a serious ear infection, but because he didn't have the verbal skills to communicate that he was in pain, that was how he was doing it instead. Again, record the behaviour to try and sort of think about what might be driving that behaviour. If it's a sensory thing, often, you know, self-injury can be like picking at the skin and things, again providing sort of alternative sensory experiences. So you know, whether that's other sorts of sensory toys or things that will kind of give them some sort of sensory feedback. Self-injury might be in response to anxiety or frustration. If it seems that there are certain situations that make the young person anxious, you know, try to either remove them from that situation or try to change something about the situation to make it less anxiety provoking. And often, you know, research has found with young people who do engage in self-injurious behaviour, sometimes it can just be about you know, frustration and maybe a lack of kind of meaningful activities in their life. So all of us, we need to have meaningful activities in our life, you know, not just work, but, you know, hobbies and interests, doing things that we enjoy doing and just give us pleasure. So it's really important that we make sure that you know, children on the autism spectrum also have access to those kinds of opportunities and things as well. And as much as possible, try to not give self-injury too much attention. Again, if it is about if the behaviour is partly about getting attention, then we don't want to reinforce that by giving too much attention. And meltdowns are, again, a common behaviour that we see in young people on the autism spectrum, and often they are driven by anxiety and their response to just being really overwhelmed. So they're not quite the same thing as tantrums. And we sort of think about the terrible twos and, you know, sort of 2-year-old children that will just have a sort of stamp their feet and have a bit of a tantrum when they can't get what they want. Often in children with autism, that you know, it's not the same thing. So we need to sort of think about it in a different way and respond to it in a different way. So we almost need to sort of see a meltdown almost as like a kind of panic attack almost. It's, you know, the young person is just completely overwhelmed. But again, using diaries can help you to notice when there might be patterns for what triggers meltdowns, and then you might be able to remove those triggers. Learning to recognise when a child is starting to escalate, and then either using distraction or kind of trying to divert them onto a different activity or moving them into a different room or different environment. Use kind of calming activities, you know, anything that the child finds soothing. And again, sort of trying to teach skills, really. So how can we teach young people to communicate when they're starting to feel overwhelmed, and how can we sort of teach young people sort of relaxation skills so that we can try and give them the skills to cope before they even get to that point where they, you know, have a meltdown. And obviously that's all going to be partly dependent on the child's age. So with much younger children, you know, wouldn't necessarily be able to use those kinds of sort of techniques of sort of teaching the child how to communicate and things. But obviously if an older child is perhaps more verbal, then there are different kinds of techniques you can use, like introducing relaxation exercises, or you know, helping the child to sort of rate their feelings on a kind of 5-point scale. So helping a child to recognize, okay, when I'm a 5, it feels like this, and when I'm a 2, it feels like this, and this is what helps me to feel like a 2. And you know, when you've got that kind of 5-point scale, that they are maybe more able then to communicate about their feelings, because they might be able to then say, oh, I feel like I'm becoming a 4. Yeah, and they can start to rate their emotions, and that can help people then to intervene and help them to regulate their emotions again. I mean, obviously there are times where no matter how much we try to predict a meltdown and we try to avoid it from occurring, it's not going to be successful. And if a young person has then gone into a complete meltdown, at that point, we just need to de-escalate and sort of use kind of de-escalation type techniques. So the first thing to do is to try to stay calm. I know that can be really, really difficult in that situation. But if a young person is feeling very overwhelmed and they're really anxious, and then they see people around them almost kind of reflecting that, that can then make their anxiety even worse. So trying to stay calm as much as possible and reassuring. If possible, try to remove the child from the situation. Just try to give the child kind of some space. We obviously need to make sure that the child is safe, but just giving them a bit of space. I mean, often when people are in that kind of meltdown stage, it might be that being touched and things is really doesn't work for them. On the other hand, for some children who are on the autism spectrum, that real deep pressure touch and being held like in a really tight bear hug might actually be really soothing for them. So there is no one size fits all kind of an approach. It's about, you know, identifying what works for, you know, for your child, and that's where PBS comes in, really, because it's not about one size fits all, but about gathering that information to see what works and what doesn't. And try to avoid talking too much when you're trying to de-escalate a situation. When any of us has gone into a situation where we are just completely overwhelmed and we've gone into kind of meltdown, the thinking bit of our brain, so that the bit that kind of processes language, that kind of shuts down, and we are really just being overtaken and driven by the emotional bit of our brain, so the bit hit kind of the back. So when we are in that stage, if somebody is talking to us, we just can't process it and it's too much to take in. You feel even more overwhelmed. So just trying to use as few words as possible, just reassuring the child, being firm and letting the child know what you want them to do. As I say, so but just all the time sort of thinking of it as a kind of response to being overwhelmed, rather than just sort of seeing it as a tantrum or something that the child is doing deliberately. And demand avoidance is something that is also really common in a lot of children on the autism spectrum, can be quite avoidant when they're asked to do things. And, you know, I mean, all of us can be demand avoidant at times. That's, you know, that's part of human nature. So if a child is a demand avoidant occasionally, that's not necessarily something we would worry about. We will all try to get out doing things at times. But for some young people who are on the autism spectrum, that demand avoidance can become very, very persistent and, you know, quite pervasive. You know, it happens in almost all situations. And a child might use numerous strategies to get out of doing something they're asked to do. So they might try to distract the person who's asking them to do something, or they might try to negotiate with that person, you know, I'll do it later, or I'll do it if this happens. Some children will kind of go into role play or pretense. So I do see some children that have got very vivid imaginations, and they might pretend, for example, to be a cat, and they might say, well, I can't do that because I'm a cat, and cats don't wash up. And often that kind of demand avoidance, it's not the same type of demand avoidance that we might see in children who just don't want to do something they've been asked to do, and they're just sort of quite willfully saying, no, I'm not doing that. Often with the type of demand avoidance we see in children on the autism spectrum, it can be linked to anxiety, and anxiety about uncertainty. So when a child is given a demand and they're asked to do something, it just triggers a very kind of anxious response, and they're really worried, I'm not going to be able to do it, it's not going to go right, or I'm going to fail, you know, and they just don't know what's going to happen. So that can lead to the anxiety. So the response is more of an anxiety driven one rather than just a refusal to do something. So often with demand avoidance, the types of strategies, again, that we might traditionally use with young people on the autism spectrum might not always work as well, so that we might need to kind of adapt things a bit. So often if somebody is avoidant about demands, one of the ways to help with that is to offer them choices. So you sort of disguise demands. So say, for example, if you're having difficulties getting your child into the bath at night, you might say, oh, do you want to bath at 6 or 7? So you've given them a choice, but actually you're still getting them to kind of do the thing that you maybe want them to do. If it is about demand avoidance, refusing to bath might also be about sensory, and then that might be a different kind of response. So as I say, we can't ever say there is this strategy for this behaviour. It would be going back and gathering that information and understanding why it's happening. So we can also disguise demands by making kinds of statements or requests or rewording things. So rather than saying, can you do, you might say, oh maybe we could do this, or let's see if this works, or I wonder whether we could try this. Or you might say something like, the clothes are on the bed, rather than get dressed. You might pretend that you don't know how to do something and ask the child to help you do the thing that you want them to do. So you might pretend that you don't know how to tidy up or put the toys away. If a child does particularly like role play and puppets, and if they tend to use those things, then you could sort of join in with that and use puppets. And sometimes if a request seems to be coming from a favourite toy, a child might be more willing to do it than if it seems to be coming from an adult. And negotiation can be quite helpful with children that are very, very anxious about demands. Again, this sort of seems to go against as parents, we're often told, don't negotiate with children. They need to know who the boss is. You're the adult. But in these sorts of situations where a young person is very, very anxious about demands and they are struggling to do what they're being asked because it's making them so anxious, negotiation can actually be a bit helpful, because it gives the person a sense of control. And when somebody is very, very anxious, the more in control they can feel of the situation, then the more able they will be to manage that anxiety. And some young people that are very, very anxious about demands actually find praise really difficult. So I've worked with a lot of children where if parents or teachers try to give them any kind of praise, the young person really, really can't cope with that. And that's been really puzzling for people, because usually, if you give someone praise, people usually like praise. But for somebody who is very anxious about demands, the praise itself might feel like a demand, because it might feel like an expectation that they've got to do that again at some other point. So depersonalizing the demand can be helpful. So like what a lovely tidy room, rather than you've done a really good job of tidying your room. So I think the key really with a sort of positive behaviour approach is to not just to get focused on the behaviour and to just target the behaviour, but to actually think about the child's environment, their other skills, like their communication skills, their social skills. And it's really about targeting all of those things, because if all of those things are likely to be a factor in the child's behaviour. And if we're just focusing on the behaviour and we're trying to sort of put strategy in place to stop that behaviour, we might not actually be dealing with the underlying cause for it. So as I said earlier, if there are difficulties with communication that might be a factor, then think about how can we help improve this child's communication, whether that be through things like PECS, like the picture exchange system for children that are non-verbal. Being able to use visuals can be helpful, or speech and language therapy type interventions. Visual timetables can be really helpful as a way to help young people know what to expect. They can see what their routine is. That can reduce uncertainty, which also reduces anxiety. You know, one of the features of autism we know is that young people like routine. Often they unexpected changes are really difficult for them to manage. So visual timetables can just help to reassure and you know, perhaps reduce the likelihood of behaviours that might be happening as a result of you know, change and anxiety. Things like social stories and comic strip conversations. So social stories were developed by somebody called Carol Gray, and they're not stories in the traditional sense. Then, you know, they're not kind of storybooks. They're more like social scripts, really, and they can be used in a number of ways. So it might be to help to prepare a child for change. So, for example, if a child was starting a new school, you might do a social story about starting a new school, which might include photos of the new school and of the teacher. And it'll sort of talk about what's going to happen at school, so the child is getting prepared. You might use social stories as a way of teaching a child a new skill. So, you know, how to meet somebody and say hello to somebody. Or it might be to help them understand somebody else's feelings, you know. So when you push you know, a child, this makes them feel sad or something. And there's lots of different examples of social stories on the internet. You know, if you Google it, lots of examples of stories that have already been written, but guidelines about how to write them. Lots of Senko teachers will have had guidance around writing social stories, so can usually help out with that. Lots of schools offer things like social skills groups or Lego therapy. So there's lots of things now within school often to try and support children to develop those kind of broader set of skills rather than just focusing on behaviour. Things like, so the 5-point scale can be really helpful for developing a young person's emotional awareness for young people that are, you know, perhaps a little bit more verbally able. But I say making sure we need, you know, that a young person's got meaningful activities in their life as well. You know, for any of us, for any human being, if we don't have meaningful activities in our life, if we don't have hobbies or interests, or you know, things that we can spend time doing that bring us pleasure, that would impact negatively on any person, you know, and lead probably to sort of difficult behaviours, or, you know, low mood and difficult kinds of feelings. And I think it's sort of easy sometimes to forget about those things. And unfortunately, what can happen is there can be sometimes a bit of a vicious cycle, because when someone is displaying challenging behaviour, often people respond by stopping some of those meaningful activities. And I worked with a young girl some years ago where that had happened. She was in a residential school, and because her behaviour was so difficult, she wasn't allowed to go out on residential trips and things. And she was just missing out on lots of things, and her behaviour was getting worse and worse. And actually, when the school were then able to find a way to support this young girl to be able to take part in those things, her behaviour actually improved significantly, because she actually had things in life that she could look forward to and things that she could enjoy. So these are a couple of books that I recommend to parents quite often. So one is called The Explosive Child, and this isn't written specifically for children on the autism spectrum. It's just about children that are perhaps, you know, quite rigid and find it difficult to change and can be a bit inflexible. So a lot of the techniques in here are quite applicable to children on the autism spectrum. There's a book here as well about some ideas about how to manage kind of meltdowns, when, you know, how to kind of prevent them. And then this is the sort of incredible 5-point scale that I've mentioned. And there's lots of sort of worksheets in there. There's lots of examples of different 5-point scales and how you might use them. And then in terms of resources, there's the National Autistic Society, which is probably familiar to a lot of you. And then there's also the Challenging Behaviour Foundation. So their website has also got lots of information on there about positive behaviour support and, you know, different ways of managing different types of behaviour. Okay, so that's all of my slides. So I've got through that a bit quicker than I sort of thought I might do when I was preparing the slides. So it does mean we've got a fair bit of time for questions. So
Thank you so much, Dr. Reynolds, that was a very informative talk with some really great practical tips, so comprehensive. In fact, I don't think there are many questions. I can see one in the chat. How do you differentiate between anger behaviour and anxiety behaviour? And if anybody else has any others, please add them now.
I mean, that's a really, really good question. And I think there isn't an easy answer to it, because they do often look the same. You know, when somebody has gone into that sort of fight mode and is lashing out, it can be difficult to tell. I suppose, you know, part of it is, again, it's that kind of looking at the situation and looking what was happening before that behaviour occurred, and other times when that behaviour doesn't. I mean, when somebody is angry and they're lashing out because they're angry, there can often be differences in you know, sort of face expression and things that can give you a bit of a clue that actually they're angry. But it's looking at the trigger that is more important, and what was happening immediately before that situation. That's often your clue. But also it's about, I guess you would be able to tell as well by your response, really. But whether it's anger or anxiety, I think often the key is about getting the person out of that situation, because even if it's anger, they need to be able to calm down, and if it's anxiety, they equally need to be out of that situation in order to de-escalate. So in some ways, in the moment, the way you might respond to that wouldn't be that dissimilar, but it's just how you then think about, in future, how can we prevent this happening again? That might be different. I can see someone's asked about how you do with meltdowns that are kind of happening every single day. Again, I think it's coming back to gathering information about what is happening in the morning when you're trying to get dressed, what is happening after school, what is happening at bedtime. When you say meltdown, like what are the behaviours? Are they always the same, or are they a little bit different? How long do the meltdowns last? Are there times when the meltdowns doesn't happen? Because there could be lots of different reasons why those meltdowns are happening, but it might not always be the same reason. So the reason for the meltdown in the morning might be different to the reason why there's a meltdown in the after school. So it might be that in the morning it's anxiety about going to school that's perhaps triggering that, or it might be that they haven't had enough sleep. Whereas meltdowns after school might be because the child has spent all day in an environment where they have perhaps been feeling anxious and stressed, because for a lot of children on the autism spectrum, school is quite a stressful environment because it's so many sensory things going on. So when the child comes out of school, they might then have this kind of moment where they're just letting go of all of that anxiety. And that's often why we might see children present quite differently between home and school. They might appear to be fine all day at school, and the teachers will say, we don't see a problem, and then the child gets home and the parents see something completely different. So it isn't possible to say, without doing any sort of an assessment, it isn't really possible to say this is why a child is behaving like this. It's really about gathering that information. And as a psychologist, when we are asked to work with children with difficult behaviour, we spend quite a long time on that assessment phase of it, because if we jump in too quickly to try and advise this strategy or that strategy without having done that assessment, then the strategy that we recommend might not actually make any difference. And there's a question about whether there's anything different that's needed for children and young people who are perhaps more able, like more verbally able, more cognitively able. A lot of the PBS type approaches are still just as applicable. We'd still be thinking about whether there's any skills we could be teaching that young person. I guess one of the differences is that obviously if the person is more verbal and they're more cognitively able, that you might be able to do a bit more sort of work with them around sort of talking to them about their kind of thoughts and feelings. They might be more able to talk about their thoughts and feelings in a way that obviously a non-verbal child wouldn't be able to, or a child who perhaps isn't as cognitively able. So then you might be thinking about sort of strategies like mindfulness type strategies, and mindfulness is a particular approach around helping people to become more aware of their thoughts and feelings, and learning how to kind of manage those in a different kind of way. And again, I could do a mindfulness is such a huge area that it would need a teaching session on its own, but there's lots online about that. Things that have been written by sort of Tony Atwood. He's written quite lots of things about sort of CBT for teenagers on the autism spectrum, which is sort of strategies to help young people become more aware of their thoughts and feelings, and more aware of other people's thoughts and feelings. And so looking up stuff on that's been written by Tony Atwood would be quite helpful. And then what approach is most helpful for a child that is autistic and mute? Again, it would be the same. The PBS type of approach would still be really helpful. So for a child who is non-verbal, often their behaviour is their way of communicating. It's that kind of non-verbal way of communicating. So again, keeping those sort of behaviour records, trying to identify when a particular behaviour seems to occur, and why it might occur, and what might be going on for that child. And then it to a certain extent it is a little bit of trial and error, because we can gather all of that information and we can have some theories about what might be going on, but our theory might not be correct. But the way that we can test that is we put a certain intervention in place and we see if it leads to improvement. So we might have a theory that a child's behaviour is due to a sensory issue, and then we might put a behaviour intervention in place to address that, and it might not help, and then that would kind of maybe tell us that actually perhaps this isn't a sensory problem. So I think if you're working with a child that's new, it is perhaps more a bit trial and error, because to some extent we're having to try and guess what's kind of going on based on our own observations and the information that we've gathered, because the young person obviously isn't able to kind of tell us themselves. So the approach is still essentially the same in terms of that PBS approach, but we're just obviously not able to get the sort of verbal feedback in the same sort of way, so it might, like I say, be a bit more trial and error. Sorry, I'm just scrolling down to see. So there's quite a few questions here about bedtime, and I think bedtimes are often a really key trigger for young people on the autism spectrum. It's definitely something we hear a lot from families, and children on the autism spectrum, it's very common that they have sleep difficulties. Again, the approach that we would recommend is to kind of keep a sort of sleep diary, so for a period of time, to try and look at what is happening in the evenings, whether there's any particular sort of patterns. Again, it might be that the child might be reacting to things that have happened during the school day. it might be about anxiety, so it might be that the child needs a bit of time before bed to sort of sit and talk about things that have happened in the day. If they have got any worries, you know, it might be that you write those worries down. You know, I've worked with anxious children before who are quite anxious before bed, and you sort of write the worries down, you put them in a post box, so then that, you know, they know that it's a very kind of visual way of showing like the worry is gone. You might have a sort of worry time where you say, right, you know, we're going to have 15 minutes where we talk about things that you're worried about, and then you know, move on. It might be that it's sensory things at bedtime that the child is finding difficult, so it might be something that you know, they might benefit from like a weighted blanket, or they might benefit from sensory lights, or it might be they need to have certain noise in the background like white noise. So it again, it's about trying to identify what might be like the particular reasons that child is finding it difficult to manage bedtime. I mean, I think with sleep often it's about trying to establish that sort of consistent sort of routine, again, whether it's having a visual timetable, trying as much as possible to avoid things like iPads and things, you know, too close to bedtime, because we know that those things give off a particular you know, light that can impact on sort of melatonin. So we all have this hormone in our brains called melatonin, you know, and it's a naturally occurring hormone. We all have it, and that is what can kind of help help us to fall asleep. So for children who are finding it really difficult to fall asleep at night, then sometimes medication like melatonin can help with that, but you know, but not for all children. But even with melatonin, it's still important to try and sort of look at the routine and look at what's you know, what might be happening for that young person. So one of the ways that that can sort of help naturally to increase melatonin is trying to get outside, you know, as much as possible during the day. Sort of getting out into natural daylight can sort of help you know, naturally increase melatonin. Having a warm bath sort of fairly close to bedtime can naturally increase melatonin. Introducing sort of physical activity at some point in the evening, so not obviously right close towards bedtime because you don't want to get the child aroused, but having physical activities and then having quiet time can be helpful. Sorry, just scrolling down to see if there's any. So someone is asking about their child making lots and lots of kind of random sounds and sort of not being able to stop. That can sort of making repetitive sounds, it can be, you know, quite a common feature of autism. It might be that it's a sensory thing and the child just enjoys the sound. For some children, it might be that it's more like a kind of tick, and like a focal tick, and the child might not even be consciously aware that they're doing it. And actually, the more you sort of make them aware that they're doing it, the worse that can make it be sometimes, because the child becomes more self-conscious and they try to stop themselves from doing it, and then actually that makes it kind of worse. So yeah, I think again it's about trying to sort of understand, is this a sort of more of a sensory thing? Is he aware that he's doing it? Does he know that he's making the sounds when they're happening? Because it sounds like he can stop when he's asked, but then sort of does it again. So yeah, difficult to tell you kind of exactly how to manage that. Again, it's without knowing and without sort of doing that bit more time of assessing and trying to understand why it might be. But if it seems like it's something he is aware of and that it's something he has got control over, and it's just something he enjoys doing, then you might try to sort of negotiate times when he can have that time where he can sit and make as much noise as he likes, or make those noises to himself. And I think sometimes when we're thinking about sort of responding to challenging behaviour, I think, like I said at the beginning, I think sometimes we need to sort of look at, actually, is this behaviour like really causing a massive problem? Like if a child is sitting there at home and they're making lots of noises to themselves, does that matter so much? Obviously, if they're doing it during the classroom lesson, then that might be a bit different. So I think sometimes we, in terms of adjusting the environment, it means that we might also have to adjust our responses, and we may be more tolerant or more accepting of certain behaviours, and accepting that is just part of somebody's their neurodiversity, and that's as long as that behaviour is not causing a problem, if they're happy and if they're sitting there quite happily doing something but they're making noises, is that a problem? So I think I'm just aware of the time. I think I've addressed the main ones. I may well have missed some because there's a lot there that I've been trying to scroll through and pick out the ones that seem to be the most common. There's a few people that they've mentioned about masking. It is something that we see quite commonly, where a child seems to be doing really well at school, and then when they get home, that's where all of that anxiety and everything comes out. And as hard as it is for parents, it also shows that home is where the child feels safe, and that's where they feel that they can let go and they can sort of show those emotions in a way they perhaps don't feel able to at school. So but it is difficult for parents, I think, in that situation, because often they can feel that the school isn't really taking their concerns seriously, or they might feel that the school is just blaming them and sort of seeing it as a parenting issue. Although I do think, well, certainly in my role, schools do seem to be becoming a bit more aware about masking now, and the fact that children might present differently at home, and that it doesn't mean that that there's anything wrong at home in the way that the child's being brought up or anything, but it actually might be an indicator that they need more support at school. So it can be helpful in those situations where a child can have a little bit of time at the end of the school day, perhaps with the teacher or something, just to talk about anything that might have bothered them or whatever, if the child is obviously verbal enough to do that. Okay, so I think that's everything.
Thank you so much. There was quite a few questions, Dr. Reynolds. That was great to go through them all. There's a few questions for the ACL team about how to access the recording. We aim to put this via our website, and we'll keep everyone updated on future courses on our Instagram site as well. So we'd be grateful if you would have a look at our Instagram site and our website for all updates. Also, if you would like to give us feedback about this course or on any of our other workshops, you can do on Trustpilot? Online.
Or Google.
Thank you again, Dr. Reynolds, for a brilliant talk, and thank you everybody for coming along for tonight's session.
Yes, thank you everybody. I hope that's helpful.